Policymakers must learn rather than teach in such debates. Before COVID, we were warned by the health expert community for many, many years that such an outbreak is coming. It was a matter of when and not a matter of if. And yet, we proved to be absolutely unprepared for it. So I'm very much afraid that this might happen again.
This year has been very important because we have moved away from emergency. We have moved away from fighting the COVID-19 crisis into a much more medium-term agenda, where we have been very keen on maintaining and developing the instruments that we have developed during the COVID-19 crisis.
We have to expect that outbreaks, epidemics and pandemics will continue and that we need to be better prepared. We want to break the cycle of panic and neglect. And the EU needs to continue to show its leadership and solidarity and commitment to COVID-19 and push these ambitions forward. We'd like to reflect also on how I believe that parliamentary representatives and some of our research leaders here can think about how epidemics and pandemic preparedness can stay high on the government's agenda, and really going beyond words here to concrete actions.
The climate change crisis is undeniable. We all know that it's actually the ultimate challenge for the 21st century. Even though we start seeing, of course, the impact of climate change with different publications and evidence data, it has been observed that over half of non-human pathogenic diseases can be aggravated by climate change. So we expect that there will be more and more cases of vector-borne diseases in Europe as well, not only in endemic countries. And one of the challenges with chikungunya, and that is inherent to the virus, in terms of epidemics or outbreaks, it's very difficult to predict when the next outbreak occurs. So from a vaccine development point of view and clinical research point of view, clinical trials, it's a challenge for us to go for efficacy demonstration because it's very hard to see where the epidemics or outbreaks are occurring. So it's one of the challenges we need to bear in mind when it comes to developing a chikungunya vaccine.
Several chikungunya cluster of cases, outbreaks may occur and occurred actually in the Mediterranean area over the last years. We had this year also smaller outbreaks of other Aedes-transmitted diseases, such as dengue. For example, we had 58 cases in Italy, plus 35 cases in France. My bet is that actually the vector competence of Aedes albopictus for dengue is a little bit lower than for chikungunya. For this reason, we had a larger epidemic of chikungunya than dengue. Of course, climate change may play a role, especially because Aedes albopictus is now establishing in countries where it was not present up to a few years ago, but also because it's prolonging the period of activity of Aedes mosquitoes. So it's important to improve preparedness and response activities, especially in areas with a high density of Aedes albopictus. And of course, it's important early detection of the disease. It's important early implementation of mosquito control measures, but also reactive vaccination is becoming a possibility.
We need to really raise awareness. In the European countries and also at the community level, to be mindful, not only to think of the disease itself, to get medical consultation or care, but they also need to have some measures in terms of mosquito control at the household level, if you will. These are the critical aspects we need to have, and also to have collaborative surveillance activities engaging with different stakeholders, including global stakeholders, local policymakers, for the introduction and prioritization of vaccination schemes when the vaccines are available.
You rightly mentioned that developing vaccines for outbreak disease can be challenging and time-consuming, with high risk and investment requirements.
I think that the imagination, the capacity to develop new ways of thinking and new ways of working has been absolutely remarkable. And we have managed to do this because we have done this together. But the challenge now is to keep this momentum alive, this habit of working together.
So knowing quite a lot about possible new outbreaks and following these localized outbreaks and phenomena in other continents and other geographical locations, do we have the information, do we have the means to obtain the information when such outbreak comes? Because you all say, and I unfortunately believe it will come once again and once again, who will be the most vulnerable groups? The unwillingness of member states to share data is persisting throughout the trialogues that I have participated or followed, and it is valid in all the spheres of European policies. The strength that we have, it's exactly our possibility, our opportunity to systematize data about 500 million people, and thus provide scientific community with really such a robust data that a lot of scientific knowledge could be provided by the universities, by the scientific centers, and so on. And here, I feel sometimes helpless, I must say, during these trialogue negotiations. But we need more vocal support from the expert community also.
This is an example from the Netherlands. We had an assessment of the shingles vaccine, which turned out to be very cost-effective. However, purely based on the budget impact, it was actually denied by the Dutch government to implement. And this illustrates for me how, from an economic perspective, often vaccines are considered more like a cost, whereas I would say it could be much more considered as an investment in health, but also in downstream savings in hospital care, hospital costs, outpatient costs, whatever you think of. We undervalue vaccines from this perspective, and then there is actually so much more from an economic perspective to be considered for vaccines. We have seen the enormous macroeconomic impact. Another aspect, also nicely illustrated by COVID, but also by meningococcus, for example, is the peace of mind that vaccines give, which should potentially also be better incorporated in the analysis and potentially lead to quality of life impacts for parents, for other family members. And then finally, in the Netherlands during COVID, soon we ran out of, as you may know, ICU beds. And vaccines have an enormous potential also to strengthen the healthcare system. So from an economic perspective, next to budget impact and cost effectiveness that is considered primarily currently, there is so much more values of vaccines that actually should be incorporated.
What do we think needs to happen? Continuing to fund R&D towards pandemic preparedness. And in this case, really working on R&D for virus families that potentially pose a threat in the future. So having standard protocols within regions, having networks of clinical trial sites that can respond very rapidly. The third important piece is about manufacturing, and having globally distributed manufacturing of high-quality vaccines that can move quickly and at scale in a future outbreak. Access to the vaccines that will be developed to those most at need, irrespective of where they live in the world.
Financial support for smaller companies would be beneficial to facilitate their path to approval and to the population across the globe. The support from the European Commission through CEPI and the recent call from HERA are positive examples, but more needs to be done to advance vaccine development swiftly. The establishment of HERA as a new actor at the intersection of science, supply, public health, and procurement is commendable.
Partnerships are critical in the context of a 100 Days mission. There is no one country, no one organization who can deliver the 100-day mission. So CEPI has a very strong partnership with Europe, with the European Commission, but also with regional initiatives such as EDCTP. And the European Union has invested in CEPI's work through the Horizon programs as early as 2019.
What HERA is striving is to keep alive the functioning of those instruments, in particular through joint procurement. We are also very focusing at the moment into supporting R&I. MEP Ayer referred to the HERA Invest fund, which is now currently developed with the EIB. We do have a great number of interesting candidates for this project. We mentioned 100 million euros, but it is a HERA Invest instrument, so we should always think in terms of leverage. So in terms of leverage, it's much more than that. We're talking about 500, 600, 700 million euros. That's very important. So we think it can really make a difference.
To fulfill its further expectation, HERA should continue to act decisively and boldly with mechanisms for rapid intervention, fast decision-making, and significant investments. Providing HERA with its own budget, like the US BARDA, would continue to allow and make a difference and find its place in the international spectrum of public health. Looking at successful mechanisms like the US Priority Review Voucher, it would be beneficial for Europe to explore similar ideas or develop other mechanisms to make emerging infectious disease more attractive for research and potential investments. These mechanisms could provide financial incentives and facilitate more investments in this crucial area. Additionally, the Joint Procurement Initiative for COVID vaccines and the success of Rescue EU mechanism are positive steps. Pursuing the creation of European stockpiles of relevant medical countermeasures to provide a backstop to emerging infectious disease would be in the interest of Europe and the world.
We need to think about how we can continue to prioritize pandemic preparedness from the government perspective, from the R&D perspective, from manufacturing perspective, to be able to move forward on the three elements of speed, access, and collaboration. Thank you.